So we have a special story from one of our listeners, followers, that I want to read to you guys, and Dr. Vadaville will answer the questions from this story as well. So um, the story is I'm 46 and had a distressing dental experience in Ponca City and Blackwell, Oklahoma. A few years ago, a dentist advised me to have all 19 of my remaining teeth removed and get dentures. I didn't have insurance, so my mom, now in late stage dementia, paid for them. However, the dentures didn't fit from the start. Despite multiple visits and adjustments, the dentist eventually admitted that my bottom dentures would never fit due to insufficient bone, something she claimed to have mentioned earlier, but I don't recall that. She suggested implants, but I couldn't afford them. Since then, I've been without teeth for over 2 years, leading to a reclusive lifestyle and embarrassment in public. I've struggled to eat and almost lost hope. I regret not opting for a partial denture to save some teeth. I shared my story to caution others and express my wish for a more caring dentist like you.
Well, first of all, we want to thank you for. We don't want to be what do we call it? The heroes of the show, right? So thank you for taking the time to share your story, so that way the listeners and our followers, can listen to your story and make some informed decision. So what I hear you say that is you lost your teeth at a very young age and you're kind of regretting the decision of having to lose those teeth, and you made the dentures, and because of the cost involved, and you could not afford for the implant, and you got the dentures, and now you're regretting the dentures are not fitting really well. I'm sorry to hear that. However, and I wish I could treat, or I could guarantee all my patients when I take the teeth out, hey, the dentures are going to fit perfectly well. I wish all the dentists in the world can say that when they are taking the teeth out, the dentures are going to fit perfectly well. I'm sorry, it is not going to be the real world, and if we are going to make those kind of promises, and nobody is going to be doing any type of proper treatment and not going to be making promises like that. So one thing I can say that is, and I don't know the state of your teeth, and if you truly lost all your teeth at a very young age, and I'm thinking that you probably had a lot of decay, a lot of severe gum disease, and I'm so glad that dentist, whoever helped you, he or she was able to help you to get rid of the infection in the mouth. And the reason that you are possibly healthy, although you are not able to wear your teeth, but I can definitely emotionally understand that how you feel that your dentures are not fitting well. And in defense of the dentist, then I'm sure they were able to help you to get rid of this infection or whatever the pain that you are suffering at that time. If they did not do it, then you probably would be suffering with the pain and also with a lot of infection. So, and again, thank you for sharing the story. One thing I would recommend though is for other people who are listening to this, and if you have concerns about the cost for the dental implants, and again, as we talked about earlier, find a place who you can fit within your budget, or possibly go to the dental school situation, or possibly go to a place where they can do some kind of a subsidized treatment. And again, wherever you are, whoever asked this question, again, explore these options of going to a dental school or finding a dental implant center which are offering dental implant treatment at a subsidized cost. Or if you happen to be in the Dallas-Fort Worth area, come see us. And we talked about a lot of options, like fitting it into your budget, a payment plan, a layaway treatment. So a lot of options, and Lynn is the best in offering these type of financial options, and we'll be happy to help you.